Hi everyone, my name is Monique Perez and I did my research paper on Nevada's Assembly Bill 474, the Controlled Substance Abuse Prevention Act, which was Nevada's bill in response to the opioid epidemic happening here in the United States. I felt that this was important because every day in the United States, more than 130 people die from overdosing on opioids. The dependence and abuse of narcotics, which includes prescription pain relievers, heroin, and synthetic opioids such as fentanyl, is a real national emergency that is affecting the general well-being of our country as well as the social and economic welfare. First off, we should talk about what opioids are. Opioids are drugs that help to relieve severe pain. When you take an opioid, they bind onto and activate the opioid receptors on cells throughout your body, specifically in your brain and spinal cord, to block pain signals. Doing this causes your body to block any pain signals from getting to your brain and simultaneously releasing large amounts of dopamine throughout your body. This is what causes you to feel that happy high and will make the user want to repeat the experience. And of the users that are prescribed opioids for chronic pain, about 25% of these people misuse these opioids, and about 10% will become addicted. Now, you might be wondering how this got so out of control that it became an epidemic. It all started in the late 1990s when pharmaceutical companies began to reassure prescribers that the risk of addiction to prescription opioids was very low. They also began encouraging physicians to prescribe opioids to patients with non-cancer related pain. This made the prescription rates skyrocket as compared to before, and by 1999, 86% of patients were using opioids for non-cancer related pain. Before it was obvious that these medications could surely be addictive, it was already too late. Communities where opioids were prescribed liberally were the first places to experience increased opioid abuse and diversion. And if you didn't know, diversion is the transfer of opioids from the individual for whom they were prescribed to others, which is illegal. Once communities began to realize what was happening, physicians were encouraged to not prescribe these opioids as nonchalantly as they had been. And with less pills up for grabs, many people turn to heroin since it is a cheap and widely available drug that gives a similar high. Deaths due to heroin-related overdose increased by 286% from 2002 to 2013, and approximately 80% of heroin users admitted to misusing prescription opioids before turning to heroin. Even as recently as 2017, there were over 400 deaths in Nevada that were related to opioid overdoses, showing us that this epidemic has surely been going on a while. Now we're going to look at how this issue was addressed at the national and state levels. The U.S. Department of Health and Human Services began to tackle this crisis by prioritizing their efforts into a few major categories. The areas that they hoped to improve were promoting the use of overdose reversing drugs, strengthening our understanding of the epidemic through better public health surveillance, improving access to treatment and recovery services, providing support for cutting-edge research on pain and addiction, and advancing better practices for pain management. This included the HEAL initiative, which is intended to improve prevention and treatment for addiction by expanding therapeutic options for addiction, overdose, prevention, and reversal. During the 2017 session, Governor Sandoval sponsored Assembly Bill 474, the Controlled Substance Abuse Prevention Act, which was passed unanimously by the Nevada legislature. It went into effect on January 1, 2018. The Controlled Substance Abuse Prevention Act prioritizes patient safety and responsibility, preserves clinical decision-making, promotes the patient-prescriber relationship, reduces the amount of inappropriate prescribing, prevents addiction to prescription drugs through monitoring and mitigating risk, enhances the quality of care for patients with acute and chronic pain, and avoids the legislation of the practice of medicine by establishing a standard of care. This legislation does not tell prescribers when or how they can prescribe, but it establishes a certain standard of care so that physicians are sure that the benefits outweigh the risks when prescribing an opioid. Although the AB474 Act is meant to make a positive impact and help the health of our nation, it could have some negative ramifications affecting healthcare professionals. One of the reasons being that it requires physicians and administrators to do a lot more paperwork than before, leaving them feeling like the new law is dramatic and unreasonable. This act also entails that doctors who violate this law 5 times could potentially lose their license. These consequences are feared by professionals because the specifics on what constitutes a violation are unclear. As a healthcare administrator, I would also be worried that this new law would make patients seek out pain management clinics rather than seeing their primary care or specialist physician. Some physicians in Nevada say that they have already lost some of their trusted longtime patients because of all the new paperwork requirements, and also the fact that the doctors are now supposed to be doing random drug test screenings to ensure that their patients aren't abusers. As a healthcare professional, some may now think twice before coming to practice in Nevada. Professionals are scared to lose their licenses over clinical errors and may choose to practice in a different state where there aren't as many regulations. This could be detrimental to Nevada since we already have a shortage of doctors. But there are also many positive effects that will come from AB 474 as well. This law is going to change physicians' mindsets when prescribing opioids, causing them to only prescribe if it's absolutely necessary. This law is also going to stop opioid abusers from doctor shopping. Prescribers are now required to run patients through a statewide database to make sure that they don't have multiple opioid prescriptions from different doctors. It is also going to improve patient-provider relationships because they will be required to get to know each other a little better so that the physician is catering to their specific needs. And then the doctors can decide if an alternative medicine would be more beneficial for the patient. And in doing all of this, it will limit the amount of opioids available for diversion and lessen the addiction and overdose rates. Here are my references that were used throughout my paper and presentation. Thank you for watching.